Hi, I am going to present the main views for the visualization-based interface for randomized clinical trial monitoring and how to use them to generate results. On the main screen, we can choose to access the participant's dashboard or the participant's analysis panel, as well as updated data and check for some hints on how to use the interface. First, let's access the participant's analysis panel. This panel has two main objectives: the visualization of participants' information, being filtered through parameters or not, and the selection of variables and phases to be viewed using dimensionality reduction techniques, such as PCA and t-SNE. On the top of this panel, we have a representation of all participants in the trial, each shown as a circle. The ones being visualized remain in the center of the screen, and as they are filtered or removed manually, they are moved to the side of the screen based on whether they are from the group of intervention or control. So let's start applying filters to create a cohort of participants. We have three methods of filtering: by the field center, by the randomization group, or by the number of days since the participant lost contact with the trial. In order to filter a field center, you only need to click on it and all its participants will be moved from the center of the screen, where remain the subjects that will be visualized. Each visualization has a legend, and that shows the number of participants that is being filtered or included by any filters present in the view. To re-include the field center, you only need to click on it again or click on its breadcrumb here on the left. When you want to select a single center, you can click on this button to filter all centers and then select the one desired. In a similar way, we can also filter participants from the control group or the intervention group. Lastly, we can also filter participants by the number of days since they should have returned for an appointment or received a phone call from the trial. So, if we selected a lost contact of approximately 300 days, all participants that have not been in contact with the study for more than 300 days will be filtered, and all that were in contact for less than 300 days will be included. It is also possible to do the opposite, including participants that were not in contact with the study for more than 300 days and filtering those who were. So now we have in total 40 participants included, which are the ones that will be visualized in the next visualizations. It seems like a small number, so let's modify the filters a little bit. Now we have 90 subjects included. Now let's see the questionnaire status visualization for these 90 participants. In this visualization, each line represents a participant and each column a phase in the trial. By clicking in each line, we can expand the subject and see the status of each questionnaire and each phase. By holding Shift, we can select more than one participant at the same time. So these participants that are selected are also selected in the overview visualization. So in the same way the selections in the visualization affect the overview, selections in the overview will affect the visualization, and all the selected participants will be shown in the temporal visualizations on the right. Apart from manual selection, we can also select participants by their ID, or by their group, meaning that if we click on this button, all included participants will be selected, but doing this would make us lose our current selection. To fix this, we can click on this button to bookmark the current group of selected subjects, and if we change the selection, we can click on the load button and retrieve our saved selection. We can also manually remove these selected participants from the visualizations. We can click on the Remove Selected button on the upper right which causes all selected participants to be removed from the center of the screen and the visualization. We can also remove them by dragging them out of the green area, and they will be moved to the correct size based on the randomization group. We can include them again in a similar way, dragging them inside the selection, or by adding them using the Add Selected button on the upper right, and they return again to the visualization. Now let's select variables and phases to create a PCA. In order to create this graph, we need to select at least 2 subvariables and 1 phase of the study. So for example, if we select weight and basal 1, the visualization is still not enabled since weight has only 1 subvariable, which is not the case if you select blood pressure since it has 2 subvariables, and so it's possible to generate the graph. Observing the histogram, we can see that as the phases advance in the study, the number of participants with values for each phase drops significantly. Therefore, if we select more advanced phases, the number of participants included will drop more and more, since only participants with information on the selected phases will remain. There are some other interactions that can be made with this visualization. For example, we can highlight which bin a particular participant belongs to in every histogram, as well as select one bin which will select all participants that have values inside that range. We can also check histograms for each subvariable and deselect them from PCA. Now that we have variables and phases selected, we can see the result in PCA. The scatter plot shows the result of the dimensionality reduction. Each circle represents a participant, and the distance between them shows how similar these subjects are regarding the selected variables. Each selected phase generates a different graph and can be accessed by the timeline below. So, the one being shown here is for basal 1, and if we click here, it shows the graph for visita 6 meses. We can also change the type of dimensionality reduction technique to t-SNE and change the color of each circle to represent a variable from the participant. A legend will appear with a color scale and minimum and maximum values for the variable, as well as the possibility to change the colors being used. So, as you may have noticed, these participants that are selected in the overview visualization are also being selected on the scatter plot. We can alter the selection by clicking on participants or holding Shift to select more than one, or also by selecting an area of the graph, altering the temporal visualization shown on the right. If we highlight one of the lines, it indicates which participant it belongs to in other visualizations. This works in other visualizations as well. So, for example, if we select participants close to each other on the scatter plot, we can see that during the phase visita 6 meses, these participants are very similar in their BMI. So, clicking in a line representing a participant, we can access her dashboard. In this dashboard, we can obtain important information for specialists to perform follow-up calls. Here, they have access to weight line charts with all weight measurements for the participant and labels showing important dates for the study, such as labor and randomization dates. We can also check the same important visualizations available on the previous panel and also print these graphs for participants to receive their progress by the end of the study.